Good afternoon. I'm glad to see that you can make it back in for your second appointment. How have you been feeling over the last couple of days? Has the chest pain resided at all? Here and there? Okay. Well, if we can rule out the fact that this might not be anything that's cardiovascular, that's always probably one of the most substantial things. But that gets to the next question. What is it? One of the common, but sometimes very overlooked ailments that people can experience with chest pain would be costochondritis, costochondritis, and also Tietzes syndrome. And what this entails a lot of the times is the cartilage in the front portion of your ribs, sometimes even into the back. If you have scar tissue or if you have anything swelling, fluid buildup, gas buildup, things like that can make the mobility of that cartilage a lot less pleasant. And it mimics the chest pain that a lot of people can experience. So if it's okay with you, I'd like to spend just a couple of minutes palpating around some of your ribs and seeing whether or not some breathing exercises, if we can pinpoint if it's dominant on one side more than the other, and just kind of proceed from there. Okay. I'm going to sanitize my hands real quick. Is it okay for me to move around and feel your chest area? Okay. And if any of these areas do make you feel uncomfortable, especially if they're painful, I want you to please just let me know, okay? Thank you. All right, I'm going to start in some of the most common areas, which is in the front of the ribs. So most of the front portion of your ribs is actually almost entirely cartilage. It's not until the sides where it actually becomes bone. So that's a flexible material, the cartilages. And okay, so we're going to start on your left side here. And I'm just going to start just under the breast and just kind of palpate on this side, all around the top of that rib. Okay, so when I get to the edges, not so bad, but like right here. Okay, just move down one rib here, more so. Okay. And on the same side, or I'm sorry, the other side, the same position right here. So that's tender. Okay. One more down. And what about two simultaneously here? Okay, very, very painful. All right. Okay. In here. I'm just going to keep on moving down. Just trying to gauge what ribs we might be looking at. On the other side. So the further down I go, the better it gets. Okay. Okay. But definitely up towards the top here. Right here is not pleasant. Okay, I'm going to start with some gentle exercises. See if we can pivot you to one side, and then I'm going to focus on very gently palpating that area so that hopefully we can get a little bit more circulation there, okay? All right, so I'm just going to very gently, I'm going to kind of control the pivot, so just let me go ahead and do the movement, okay? How's that? Okay. I want you to hold that position. If you need your arms to stabilize your posture, that's okay, okay? Alright. I'm going to take a couple of moments here and just focus on kind of gently opening up those ribs here. I'll start with some light pressure first. Just small little circular motions in between that top rib right there. And I know this might be a little uncomfortable, but I'd like you to take a deep breath in and hold it just for a couple of seconds, okay? Okay, go ahead and let go. Exhale. I feel good. A little bit better. Yeah, sometimes it's a little bit of a release. Gonna move down just a little bit more to the side. And do the same on the other side. I'm going to pivot you very gently, facing the left, okay? And we're going to focus on the right side here. Gentle palpations to start. Go ahead and take a deep inhale and hold it for a couple of seconds. Go ahead and exhale. Gonna move to one rib. Gently massage there. Alrighty. I'm going to move you back to center here and go ahead and just let me control the movement. And don't strain yourself. Does that feel a little looser? Go ahead and just try to inhale and you can feel your rib cage expand a little bit there. A little bit looser. Do you feel the chest pain in the center here at all, or is it just under the ribs? Okay. Alright, I'm going to focus on just the center, and I'm going to gently move up the center. And I know that this is not where those ribs and that cartilage is, but it might just be muscle tension that is bridging upward. So a little bit of massage can sometimes be really nice and alleviate a lot of pain. So just going to start here at the sternum. And just kind of move my way up a little bit. Go ahead and just try to elevate your chin a little bit here. Stretch out your chest a little bit if you can, okay? Good. I'll help point is we're trying to loosen up and flex all the little tiny muscles and tissues in between the ribs. We can do that through massage, through stretching, and often it's a combination of those two. And one other thing that we can do, and I'd like to try, would be to have you lean back quite a bit. And I'm going to focus on placing my fingertips in between the spaces between your ribs, and that way you're leaning back into it, stretching out the front, also giving quite a nice little massage in the back, okay? Alright, so if it's okay, I'm going to go ahead and tilt you just a little bit more. I'm going to tuck my fingers in behind your chest, okay? And please again, let me know if this is too uncomfortable, okay? And now with my fingertips, I'm going to press deeply on each side of your spinal cord. Just take a couple of really nice deep breaths for me, okay? I know it's not always comfortable. Just bringing new blood circulation to those areas. Getting forward a little bit. Gonna go down the spine a little bit more. Another deep breath for me. Okay. Arch the back a little bit more. Okay. Gonna kind of walk my fingers up the back. Probably about T2, T3 right here. So go ahead and a couple more deep breaths for me, okay? Seems like a tender spot right there. Okay, I'm just going to focus on that one right there. It's a little bit above the center of the shoulder blades, so I can definitely have like a band of tightness. So I'm just going to run my fingertips deep within that little groove between your shoulder blade. Down a little bit and in between the ribs. Just kind of alleviate some of that tightness. Does it feel any better? We're making progress. Holding that same posture if you can. I'm going to move around to the front and I'm going to focus on the areas right in the front, okay? Okay, and just some deep palpations that are going to be right here, okay? And we're remain as upright as you can. I'm going to pivot you just a little bit more. Alright, now we're going to focus on your left side. Just kind of push on that cartilage a little bit and give you a little bit more flexibility. Just move it down the side. Okay, take a deep breath in for me and then hold it for a couple of seconds. And go ahead and exhale. Okay. Going to do the same. I'm going to pivot you to the other side a little bit more. And we're going to focus on your right. And inhale and hold. Go ahead and exhale. Good job. Go ahead and relax a little bit. I know sometimes that's not always the most comfortable, so try to get comfortable, loosen up a little bit. And I know that this is not sometimes always an immediate fix or immediate relief, especially when it's in the center of your chest. It just seems to linger there a little bit. There are two main exercises that I would recommend doing regularly at home if you have spare time, if you're in a comfortable space, if you're starting to feel that tightness build up around your chest and into your ribs, is to take something like a sock, 2 socks, 3 socks, roll it up into a ball and place it right between your shoulder blades when you lay down. And what this is going to do in many cases is expand the front of your chest. Inhaling and exhaling deeply allows for that tissue in your cartilage between your ribs to slightly separate and then come back. And that stretching can be very, very, very good for those areas. So that's one thing that you can do, whether it's on carpet, it's in bed. You just want that expansion of your chest. Another exercise that you can sometimes do, given that you have the space for it, is to sit up nice and strong, elbows out as high up as you can get them, and to rotate. This is a slightly different stretching action, so bear with me here. I'd like you to hold your arms out as long as you're comfortable. Okay, I'm going to pivot you around a little bit just so that you can kind of feel what that motion is going to be like. Okay. And this might be uncomfortable to start, but the more you do it, the easier it will become. Okay? Okay. So go ahead and lift up, and if we tilt to your right, and as you take in some deep breaths, you're going to feel that chest expansion. And then over again to the other side, and back. So Sometimes holding it in one position for a little bit of time can be helpful too. Then back. And tilting back. And doing the same process. And you can feel that stretching motion. We're just going to give you a little bit of a swivel here. Keep holding those arms up. Okay. And sometimes these exercises, they can only take a couple of seconds out of your day. You know, when you get in and out of the car, when you get a 2-3 minute break at work, you know, whatever your situation. Okay. And we're going to go ahead and sit you still again and just go ahead and lower your arms, relax. Take in a nice couple of deep breaths. Okay. And before we close out this meeting and our get together, I'm going to examine some of the areas lower down in your tummy, just because this isn't really a confirmed diagnosis and we haven't seen any substantial progress. I am always concerned that there might be something else that we're overlooking, and we just want to be thorough. So just going to work my way down your chest a little bit to your belly area and just kind of palpate gently in those areas. Is that okay? Okay. Again, let me know if any of this is uncomfortable, if you'd like me to stop. Okay. Moving along where your large intestine goes up underneath the ribs. All right, in here, do you feel that chest pain when I'm pushing right here? Okay. With any kind of dietary restrictions, have you noticed that this pain is lessened? So on your right side. I can feel some gas, and that's very common. Don't be embarrassed by it, not at all. We're only human, right? Okay, what about on this side? Do we have the same or similar sensation on this side? Okay. Alrighty. It could be a multi-issue. It's not always just one thing. I would like to schedule you in a couple of days, with your permission, for some food sensitivity testing, as well as possibly a endoscopy. If you have something like ulcers or something that's being irritated within the stomach and the esophagus, that can also mimic chest pain. You also do have kind of a little bit of gas that I imagine must be uncomfortable. And if we can rule out anything in the stomach area, that would be fantastic. Or, you know, maybe it's a dietary adjustment that we need to make. Maybe there are certain foods that are triggering a reaction that are very unpleasant. Okay. For now, try to maintain some of those exercises. At the very least, it's good for your flexibility, and it certainly can help alleviate some of that restriction in the chest and, in the torso area. And it can feel kind of good to get a massage too. And then we'll just go to the next step. In a couple of days, we'll get you back in here and do some sensitivity testing. All right, my dear. It's been a pleasure seeing you. I hope next time it's under better circumstances, but we'll see you in a little bit. Okay, try to take care of yourself.